This is a story about hope, about progress. This is a story about the remarkable transformation children diagnosed with early motor delays have made through early detection and early therapy intervention. It is a story about the great strides Pathways Awareness Foundation has made in their quest to assure the best for all children's physical development. In their lives, children with early motor delays stretch beyond their own limitations to gain independence as they enhance their lives physically, mentally, and emotionally. Through therapy, they work to widen their world and celebrate life. Pathways believes in empowering parents through knowledge so that children can achieve their fullest potential.
Each year, over 400,000 children in the United States are at risk for developing an early motor delay. Over 100,000 children in the country are affected.
Babies with early motor delays, such as hypotonia, or low muscle tone, and cerebral palsy, can learn to master their physical developmental steps with support. A motor delay is not a disease, it is not inherited, and it rarely includes a mental condition, and symptoms do vary widely. In infants, it may be a physical condition which can affect the ability to chew, to swallow, to roll over, to pull up, or to raise their head. Pathways believes that physical, occupational, and speech therapy can teach babies the language of proper movement. Pathways practices are based upon the expertise of their medical roundtable, which is made up of some of Chicago's most distinguished pediatric medical professionals.
The work that Pathways Awareness Foundation is doing is truly unique and truly groundbreaking. There's no other organization across the country doing as much as Pathways Awareness Foundation is to address this issue of early motor delays and to validate the power of early detection and early intervention services for children.
You might have heard about Pathways through their print or radio ads, or seen articles in the newspaper or online, or perhaps a segment on WGN, as they continue their outreach to parents. The website, pathwaysawareness.org, is parent-friendly and enhanced by its growth chart, streaming video, parent stories, and important answers for parents. Pathways continues to reach medical professionals by exhibiting at conferences across the country, sharing their survey results, distributing their milestones growth chart, teaching videos, and slides.
Pathways Awareness Foundation Critical Motor Milestone Growth Chart is endorsed by the American Academy of Pediatrics, by the American Association of Nurse Practitioners, and it has been embraced by parents and medical professionals across the country.
Pathways is now in the second phase of a proposal to the American Academy of Pediatrics to develop an online continuing medical education course about detection and treatment of early motor delays. Pathways encourages parents to learn what early milestones are expected while their baby is very young. A national survey conducted by Pathways Awareness found that an astonishing number of parents are not aware of critical warning signs which could help them identify and address early motor issues in their children. While babies do develop at varying rates, missed major milestones should be brought to a doctor's attention immediately. With early intervention and therapy, beginning as early as 3 months, children with motor delays can and do learn movement through a problem-solving approach called NDT, Neurodevelopmental Therapy.
Physical movement improvements have the greatest potential for improvement due to plasticity of the pediatric brain. Improvements in physical functioning through therapy and through early intervention can make a significant difference in a child's long-term ability to perform sitting, walking, talking, and eating.
This is clearly apparent at Pathways Awareness sister organization, Pathways Center. The children here are living proof of the value of early intervention and early therapy. Let's take a look at some of their stories.
We have the opportunity to truly make a difference in the lives of the children that come through our door, and also to help the parents to see the potential and the possibility for their child. Well, Freddie came to Pathways when he was quite young. He was about 2.5 months old, and his family was very concerned about his ability to use his upper extremities. They felt that he was kind of restricted in his movement. Now he's doing much better with his bilateral hand use. He will spontaneously reach with the right hand. I would say the future looks great for Freddie.
When Sophia was first here, came to Pathways, she presented as having extreme difficulty keeping her head in midline. She would pretty much arch back, was the only movement pattern that she had, and that really did not allow her to communicate or interact with her environment.
Sophia is in love with walking. She is just a stunning child that grabs everybody's attention as soon as she comes into a room.
I had the fortune of working with Josh for a 1-month intensive program, 5 days a week. The big goal was to be able to stand independently and take some steps independently.
Josh has made some wonderful improvements. He's now walking several steps independently. He can stand for up to 30 seconds. He also has a wonderful ability to plan all his movements and to problem solve how to get from one place to another. Suki was referred to us directly out of the neonatal intensive care unit. Neonatologist and the staff that worked with her there was concerned about her very low birth weight. By the time she was 2.5 or 3, we were able to move into a dance program and kind of address the lower extremity coordination and strength issues that she needed to work on. I think what the most astounding period to me was how she came to us as a 2-month-old infant and the change that she made over the first 2 years. This is truly what we hope for and truly what we look for with the early detection and early intervention.
Pathways continues to make tomorrow a brighter day.